Good morning, everyone. Welcome for coming. It's my first experience as a moderator, so quite nervous. I've been involved with Kidney Cancer Canada, Cancer du Rein Canada, as a volunteer for over 2 years and a half. And I'm a board member for a bit more than a year now. Excuse my French accent, I don't know what happened. I wake up like this morning. So, I was born and raised in Quebec City, and I've been in Montreal for work for over 30 years. So, Mona, Jocelyn, JP, I don't know if Brigitte is there this morning, but if I missed some words, looking for my words, please help me. Help! So let me introduce our super panel of patients this morning. Just before, I just want to tell you that I'm also a patient. I was diagnosed in late 2008. I had a total nephrectomy early 2009. I'm a non-clear cell patient, and I had a recurrence 4 years after my first diagnosed, and I'm on my 4th line of treatment right now. So, the good news is I've been stable for over a year. So, okay, so let's meet my friends for the day. Nancy Barnes. Gord Ivanoff. And Christine Collins. So Nancy, I will. You want to break the ice this morning and introduce? Let us know more about yourself, please.
I will. Sure.
Thank you.
I'm so happy to be able to be here, and this is my first time attending a kidney cancer conference. Never mind sitting on a panel and talking about myself. So I'm probably a little nervous too, but anyways, my name is Nancy Barnes, and I am from Calgary. I'm here with my husband, who is my best friend and my support, caregiver, care partner in my journey. We have 3 grown sons now who are still coming and going and living at home at times, but eventually hope to be launched. I am also a nurse, and I've worked in the profession for the past 30 years, and a majority of that time I was working in oncology. I've worked, I'm a UBC grad. I've worked at the BC Cancer Agency, Tom Baker Cancer Center, Foothills Hospital, and I'm also living with stage 4 kidney cancer. I was diagnosed initially in 2013 when I found a big lump in my abdomen, which I asked my doctor about, and the doctor said, well, we can check it out with an ultrasound if you like. And so I said, yeah, I think I would. And within 2 hours, I had the diagnosis of kidney cancer. And I was absolutely floored by my diagnosis because I actually thought I'd already done my cancer tour of duty back in 2005 when I was diagnosed with breast cancer when I was 41 years old. And it was stage 1, and I was freaked out. So I said, I want a mastectomy, and I had 4 rounds of preventative chemotherapy. So I thought, I've served in my time with cancer, and I thought I was done. So when I had this diagnosis, it floored me. I was really scared. So within 10 days, I had a radical nephrectomy, and they also took my adrenal gland. I don't remember really any discussion about types of surgery that I would have at that time. It was just get this out of me. And I was just, responding to what had happened. Great doctor, Dr. Martin Duffy in Calgary, did my surgery, and I recovered quickly after that. When I finished the surgery, I was discharged 5 days later, and they said, "You're good to go." And I was like, "Really? That's it?" And I had difficulty moving on with my life. They said, active surveillance is your treatment. And I really found that hard to deal with emotionally. And for a couple of years after that, I really struggled because I didn't know what to do with myself. I was basically living with fear and anxiety and a lack of trust in my body, thinking, what is going to happen next? So I eventually got on with it, and 4 years after I had my surgery, I was having routine surveillance, and they found a few little shadows in my lungs, and it turned out that I had nodules in my lungs that were confirmed with a biopsy that caused a pneumothorax for my lung to collapse. Anyways, it was confirmed that it was metastatic kidney cancer. So to me, this was the most awful, devastating news ever. And I have been dealing with that ever since. But since that time, I went on active surveillance because the nodules were really small, and that was my choice. I had a choice of starting treatment right away or active surveillance, and I chose the active surveillance because it was small and slow growing. And that carried on. It was quite stable for a year and a half until it started to grow. So then I started on pazopanib, or Votrient, which is sort of like a sister drug to sunitinib. And I was on that for 5 or 6 months, and it showed a mixed response. And so there was some discussion about radiation treatment, and it was with discussion with my doctor in Calgary, Dr. Daniel Heng, who's really good. And it was decided that I would switch drugs again, and so now I'm on immunotherapy, and I'm taking nivolumab, and I've been on that for just over a month now, and I go in for infusions every 2 weeks. And have blood work every 2 weeks. And so far, I'm tolerating it really well. And yeah, anyways, I just wanted to say the last piece of my little story is that since my diagnosis with stage 4, the fear and the stress and the anxiety, I decided that there has to be a better way to deal with this, because this is my life. And I started to look at people that have moved on and people that are living either with cancer or people that actually have survived it, like my idol, Stephen Andrew out there. Stories like that give me hope, and I hang on to stories like that. And I've had to dig deep within myself, and I've done a lot of, reading about positive things and informing myself and learning to take control of myself and my thoughts and trying to make myself as strong and healthy mentally as I can. And I think that's going to make me the best person to go forward and deal with the things that I have to deal with this disease.
Okay, so we'll be maybe to talk
Okay.
more later. So, Gord, could you talk to us, let us know more about yourself?
Sure. Okay. I'm a thorn between two roses here today, and that's good.
Wearing the red.
Even though my name is Gord Evanov, which is a Bulgarian name, you can turn me down now. I'm of Scottish heritage, so that's why the pants. The kilt wouldn't fit in the suitcase. I'm from Mississauga, Ontario. This is for crying. I cry a lot. We're here with my wife because my social worker and oncologist, after unfortunate set to in Christmas time, I woke up with a broken rib in the middle of the night. And there was, oh, you fell. I was getting out of bed. I said, no, I just woke up and I was almost paralyzed. Went to emergency and they couldn't find anything. Phoned down to Princess Margaret. Got a CT scan and they said, oh, you have a broken rib and it's a metastasized lesion. I try to cope with this most time. I'm a very happy person. I have a really weird sense of humor, so don't be offended at anything I say, because I cope by labeling things, categorizing them, and giving them funny words. I started off as the luckiest patient at Princess Margaret because I was fighting kidney stones through the summer of 2009, and they were weird kidney stones because they don't show up in x-rays. But they're there, and trust me, they hurt just as bad. But you can take pills to dissolve them. And while I was going through this process over a 4 or 5 month period, they kept saying, the scans look good, but there's this weird shadow we can't identify. In 2 months, it turned out to be almost a 10-centimeter tumor. We took it out. It was very successful. I was sent down to Princess Margaret to see Dr. Knox to go on to a drug therapy test. And as all things would have it, I wasn't eligible after all their testing because it had already metastasized to my lungs. I've had a total of 3 operations, 1 for my right kidney being removed, 2, I've had a total of 8 tumors taken out of my lower lobe in my right lung. It will never come back again because this time they took the whole lobe. But I'm also now being monitored because I have 5 other tumors in my lungs and in my lung area that are were treated with Sutin for a 3-year program. They shrunk from 2 to 3 centimeters down to all of them are less than a centimeter, but none of them went away. So now we've been monitoring those and keeping an eye on them, and I'm the champion of CT scans in Toronto. I've lost count at about 45 or 50 of them. I go every 2 to 3 months for ones just to keep track of things and see my oncologist, and yep, everything's still stable, everything's still good. So there's always hope, there's always faith. I'll never be NED, which is no evidence of disease. That was my first one of these meetings, was the first one in Toronto, and that's got to be 8 years ago. And the only reason I came is because my oncology nurse said, Gord, here's a pamphlet, here's a description. I'm speaking at this seminar, you've got to be there. And I said, I don't do those things. That's a waste of time. I don't want to be around a whole bunch of sick people. There's my humor. And so she insisted, so we came. And we've been to everyone in Toronto. This is either our 4th or 5th one. And this came about because of the broken rib, met our social worker and support person. And he said, you're really healthy right now. Things are good. You've come back, you've put on some weight, you got good color. Go somewhere, take a trip. Silly me said, well, Kidney Cancer is having their meeting this year in Vancouver. He said, it's wonderful this time of year, book a flight. So we did, and here we are. And thank you for coming and meeting me.
Christine, 2 years ago, you were the moderator on the patient panel, and I was one of your patients on their panel, so change of grid procedures today.
First, I want to say welcome and let you know that I am a Vice Chair of Kidney Cancer Canada, and I'm very honored to be that person. I have learned so much and met so many of you, and every single story is different. Not everyone in the room is a patient, but I'd say the majority is a patient, and everyone has a very different story on how they cope and how their treatment is going, what stage they are. And as we heard today, Kathy's story and Gord's story are very different, as my story is. I was first diagnosed in 2010, and I am under active surveillance. I was found incidentally, which kidney cancer usually is found incidentally, and it was for kidney stones. And just for those of you out there that don't know, kidney stones, it's not proven, but kidney stones and kidney cancer often are connected. So that's how I was discovered, and I am under active surveillance, so I've never had any treatment for my kidney cancer. I still have my active tumor. So that's like coming up to 9 years. It has grown very minimally, and I say thank you every day. I have a great team at Princess Margaret that take very good care of me. I go for scans twice a year, and not to say that I haven't had my scares. I have, like Gord, had a section of my lung removed, and thankfully it was not cancer. And it's a different therapy that you. Sometimes I felt guilty when I first started because so many people were having terrible side effects on their drugs and difficulty with their surgeries, and here I was. But you know what? When you get the cancer diagnosis, you have cancer, and you live with it every day. And we all know that when we get a little pain or you're not feeling well, the first thing that comes into your mind is, okay, what is it? This could be the cancer. So we all live with that every single day. And it's just a way that we have to find our way of coping, as Kathy has found her way of coping, and Kathy is thriving. That's what I like to use now. We thrive with cancer, and so many of us are. Yeah, we have our bad days, no question, but we have a lot of good days too. And Gord is thriving with his cancer. He's found his way of coping, just as I'm sure all of you have found your way of coping day to day. And thankfully with our caregivers and our families and our teams, we keep going. So I don't have a lot of medical to impart. I just keep going, and it's important that you find the right doctor for you and the right team for you, and you do the right things that are right for you. And before I go, I have to say a shout out for Karen. Karen is our board member, and she was ill and not able to join us, and she is a great volunteer on the East Coast. I'm sure some of you have met her before, and I told her I'd give her a shout out while I was up here. So thank you.
If anyone has question in the audience for our panel, and for people joining us with live streams, just feel free. We'll be there to answer your questions. So first questions, my friends. Since you were first diagnosed, do you feel that people have treated you differently? For me, an example. It's like I became a different person. I found out that some people were kind of uncomfortable around me. Like, for some, they don't know what to say. It's like it's like for them, I became the disease. So I would just want to know, for you three, did you experience something like that ever since you were diagnosed? Go ahead.
I would. Can you hear me?
No.
Did it turn off? Sorry. I'm done. I think we're, there we go.
We're back.
I would have to agree with you, Helene, for me as well. Particularly with this, well, I mean, I've had many diagnoses, and I felt like I had like a big label on my head with a big C, but with the stage 4, I also wore it differently. I think it's how I looked at myself initially as well, like I was, it's how I thought of it, that I have a disease with for sure, known cure. And so I just assumed everybody else looked at me like that as well. And so it's how I perceived other people to think of me. And I definitely would go out, my husband would take me to work functions, and I would be able to tell if they knew about my diagnosis or not, because the people that knew would kind of look at me and then maybe ask say hi and then walk away or something, and I could tell. And that really did bother me, but it was also how I was feeling about myself. And it's been 2 years, and I have learned to not really care. and just to embrace my own life and, put my best foot forward and enjoy every day. And I just think I want to be like an example, like a living example of thriving with cancer and sort of embracing cancer. Not that I embrace it, that's not the right word, but incorporating it in my life and making it part of my life, not who I am. And so definitely I have opened up with my story. I used to be really private and not even want to talk about it with my friends. And now I'm far more communicative and just say, well, I'm really tired because I'm on this drug that makes me tired. And I used to brave it out and stay up. And anyways, I would say it's different.
I have to agree with Kathy.
Nancy.
Nancy. I'm thinking of
He's Kathy.
Sorry. Nancy, my apologies. Everybody is different and how they deal with it. Some people like to share it with everyone. I kind of felt that nobody needed to know. I live in a small community, and it's probably kind of, my cover's blown probably now, but I tended not to tell anyone because I do feel that at times people do treat you differently. And you do learn who your friends are, and you do learn who's really there to help you through it and be there for you. And I'm sure we've all shared that. So I was cautious. My personal is I was very cautious on who I shared. The people that needed to know knew, and I don't tend to talk about it a lot with anybody else, except now in this role I'm forced to and have my picture taken. Gord.
Of course, I said at the beginning I have this weird sense of humor, which makes me a bit of an off-the-cuff person. I treat it as a new journey in life. Not one I chose, one was forced on me, but I treat it as a journey, something new, something different. You find out who your friends really are quickly, because I believe too long people have put the C word behind them. They don't want to talk about it. It's a big secret. My grandfather at 65 died from having his tonsils taken out. And he was a lifetime smoker, and he worked in the coal mines in Scotland, and he had his tonsils taken out. Come on. Because they wouldn't talk that he had lung cancer. I told a bunch of people, our family, of course, was very reserved. It was almost like they were frightened at the beginning. And I think because all of us here have known too many people that have had a diagnosis, they've got cancer, and they're given a very short period of time because they didn't catch it early enough. And that's my motto. Let people know. So they will get tested. They will get checked. It maybe right now is not able to be gotten rid of completely, but we can live with it. But if you let it go too long, then you get one of those messages you don't want to hear. And I think we're all to that. And my friends, the ones I thought were my friends, are like, no, people I didn't really think were close friends are the ones that come up to me regularly. How are you feeling? How's it going? You're looking great. Is everything okay? And they want to know. The other ones is just a passing, hey, how you doing, bye. And they were the ones I thought were my best friends. So you have to find that avenue. You'll find people that will support you, people that will shun you. But find those. It's a journey. It's a journey you're on. You can't stop it. So embrace it and find those support people.
There's anything we could do to make people more comfortable about when we feel that they're not, and help people understand that we're still the same person. We still want to live active lives and still laugh and have fun.
I'll go first. I'll discontinue. Yeah, I think it's a matter of convincing them, A, it's not contagious. You're not going to get it from me. My wife got my pink eye from me. We almost didn't make it here. 2 days ago, the ophthalmologist gave her permit to travel, okay? And she's cured. It's gone. But I think it's important to, like I said before, find those people. There are ones that are comfortable with it, okay? And nurse them along. There are some people you're just never going to convince, okay? There's just certain people that it's, So, like I say, it's a journey. Find those people, support people. Try to find some fun in life. Try to enjoy it, The other thing I love is slogans. I pick these up from my doctors everywhere. My favorite one is, if it looks like a duck and walks like a duck, it's probably a duck. And that's how I was told I had kidney cancer. That was the exact phrase my urologist used. Find that stream. Be happy. Try to enjoy it. It's your trip.
We only have 4 minutes left.
Oh, you're
Time
kidding.
flies.
That's gone too fast.
So let's end it on a funny note. What does your caregiver do that drives you crazy?
My caregiver is here.
Yeah, okay, I'll ease up the question.
And mine told me not to answer that question if it's asked.
Okay, I'll do it. JP, I've been with my husband for 24 years now. So, I think anything after 24 years can, it could be a pair of socks by the side of the bed every morning. But no, he's been a super caregiver, always my strong side. But I think it's hard. Sometimes I think I would like him to maybe share more with me, but I think it's his way of coping, and not sharing with me is to protect me sometimes. So that's my part.
Okay. I just want to, because of my situation and my care, I don't have a lot of care that I need. But I have to say, when I did have to have surgery, I have an entourage of my family that has to go with me. I'm sure we really make the hospital mad. But you know what? If that's what's good for them and that's what's good for me, then that's what it should be. You should manage your care what's right for you. If it makes you feel good having 3 of your family members there, then you know what? That's okay. They can go get coffee when the doctor comes. And I just want to say thank you to all of my family, because they have been so supportive, and it has been ups and downs, but I do truly appreciate them.
Good. You're still not going to answer?
I thought you were going to answer for all of us.
Okay, no, not at all. Sorry.
No.
You're on the spot. We're
Okay.
finishing like that.
Oh, okay. Yes, you did say be kind. We've gone through the last probably 20 years of a lot of ups and downs in the medical field. I've had both hips replaced in my 50s. My wife's on her 3rd knee replacement. And we support each other. I mean, we drive each other crazy sometimes, but after 42 years of marriage, you're allowed that. And it's the little things sometimes. It's not the support. When you need the hug, it's there.
Great.
It's the little, did you put your socks in the hamper type of things, which are so immaterial in life, especially on this journey, that it's like, yeah.
Thanks, Nancy.
Well, I would have to say my husband has rose-colored glasses all the time. And I guess that is actually a good thing, but at times it really does drive me nuts, because I could be really grumpy and feeling really down in the dumps and negative, and he is planning our, 10-year trip or his, retirement, and I sometimes feel like he doesn't quite, we're not on the same plane, he doesn't quite get it, but I love him for that, because it's better than the opposite,
Yeah, it's good. It's good to have little
Yeah, he always brings me up, and doesn't always relate to what I'm feeling, but he's always there.
Thank you for sharing, everyone.
Thank you.